Dealing with low thyroid symptoms can make weight loss hard enough, but it's even more frustrating when you're putting in the extra effort and not seeing any changes or improvements. So today we're going to talk about two key factors that you're probably not aware of that could be contributing to your weight loss struggles. And of course, if this is the content that you've been enjoying and you like to see this sort of stuff, I always appreciate it if you can click the notification bell and also subscribe to the channel. My name is Dr. Bodle, and I specialize in helping women with Hashimoto's and low thyroid to lose weight and improve their energy naturally. But a story I've seen 1,000 times over is when we start on these new health journeys and we're trying to make these changes, but we don't see any results, we falsely assume that it's our fault and due to lack of effort. So if we've made dietary changes, maybe we think, well, I didn't pick the right diet, or I haven't been following it strictly enough. Or if we're trying to increase our exercise, we might think that we're not being intense enough with our exercise, or we're not going frequently or having long enough gym sessions. But the problem is that when it comes to thyroid issues, we have to make specific changes for our thyroid that make us a little bit different than everyone else. Because believe me, the reason you're not losing weight isn't due to lack of effort. One of the biggest things that you can take away from this video, and kind of the unifying factor between the two keys that we're going to discuss, is that people who are inflamed have a very difficult time losing weight. And one of the hallmarks of thyroid dysfunction is inflammation, whether that's occurring at the gland itself or in some of the downstream areas that our thyroid gland affects. To know if you're dealing with inflammation, there's two ways that we can look at it. Either we can look at our labs or we can look at our symptoms. And when it comes to our labs, we want to assess some of those big inflammatory markers. Things like C-reactive protein, homocysteine, fibrinogen, vitamin D, and hemoglobin A1C. And although those are great markers to assess where you're at and also track your progress, keep in mind that they don't necessarily have to be elevated for you to be inflamed. These are just the most common ones that can be reflective of inflammation, and they're easiest for the labs to check. But there's a whole host of other inflammatory markers that can be occurring in our body. We're just not going to see them on the lab report. Because of that, the other thing that we always want to look at is our symptoms. And whenever we're talking about chronic inflammation, I'm always thinking about symptoms that are widespread and generalized. Inflammation is going to circulate throughout the entire body, and therefore we can see things show up like fatigue, chronic pain in our muscles and joints, especially if we haven't had previous injuries in those areas. We can also have brain fog, depression, skin rashes, and also bloating and swelling. But the last thing that we need to keep in mind when it comes to inflammation and weight loss is that fat itself is inflammatory. So if we have been overweight or obese for a longer period of time, that is going to increase the inflammatory load on the body and make it more difficult for us to lose that weight. Not impossible, but certainly more difficult, and it is a situation where we're going to need to be a little bit more patient with ourselves. So if we know that inflammation is making it difficult for us to lose weight, what are the two factors that are causing us to get hung up on this, even when we're putting in the extra effort? Well, the first one is overtraining, or very simply, exercising too much. Now, this is something that I've talked about before, and I've even made a video on it. So if you want some additional details, you can check that out, and I'll link it for you up above here and also put it down in the description below. But essentially what we need to understand is that exercise causes breakdown of tissue. And when that happens, there's going to be an inflammatory response. Yes, exercise long-term is anti-inflammatory, but in that acute stage, there's going to be some amount of inflammatory load that we have to be able to deal with. The problem is, because of our thyroid dysfunction, we are already struggling with inflammation. And we know that because of all the labs and symptoms that we just mentioned. So what happens is we create a new exercise routine and we get all excited about it, and we go out and we execute on it. Week 1, no change. Week 2, no change. Week 3, we weigh ourselves and we've actually gained weight. Well, when we're putting in effort like that, we're going and grinding, whether doing our walks, going to the gym, whatever it might be, we would like to see at least some amount of progress and weight loss. But because of the inflammatory load and because of the additional inflammation that exercise puts on our body, it's going to be very prohibitive of us to be able to actually break down those fat stores. And also, we'll notice that a lot of our symptoms will tend to get worse. This means that not only are you not losing weight, but you also might be seeing increases in your fatigue. Maybe your sleep isn't as good anymore, or you're having more noticeable joint and muscle pain. And we can really continue down the list on all those symptoms that we've already discussed. But besides the long-term worsening of symptoms, the other way that you can tell that you're overtraining is by looking at how you feel immediately after exercise and also in the 2 days following. So when we exercise, we should feel better. Now, of course, we're going to be slightly tired, but movement helps to stimulate our brain. It moves our joints. It strengthens our muscles. All of these things are good things. If we don't have that and we're feeling much worse, that's a problem. It means that we're overstressing the system and causing that increase in inflammation. So if you exercise and your whole day is shot after that, or you need like a several hour window to be able to recover, or even you feel as though you need to nap and sleep, these are all indications that the intensity of the exercise you're doing or the duration of the exercise is exceeding your capacity to deal with the stress. In terms of the 2 days following, of course we're going to expect some amount of soreness, especially when starting a new routine. But if you're having debilitating and overwhelming muscle cramping, fatigue and endurance problems, and also widespread muscle and joint pain, then this is another strong indicator that correlates with the fact that we are overtraining. But I hear you. It feels good to be taking action, but we also have to listen to what our body is telling us. So if you are having some of these symptoms, you're going to need to look at decreasing the frequency of your exercise, the intensity of your exercise, and potentially changing the activity that you're participating in. Also, keep in mind that for some of my patients who have been dealing with this stuff for a long time, we may defer a specific exercise regimen until later on in their care plan and only have them do simple things like walking in the beginning. Sometimes exercise is just too much for our system and it becomes detrimental when we're trying to go after it too aggressively. But what has been your experience with exercise? Let me know in the comments below and tell me if exercise is something that's been really beneficial for you or if it's something that always seems to be a struggle. And if you've made some changes or modifications and have learned some ways that your body responds better, what do those changes look like? I'm looking forward to hearing your guys' response. Now, the second key factor that we have to understand when it comes to inflammation, thyroid, and weight loss is, remember those fat cells that we talked about and how they are inherently inflammatory? Well, what do you think happens when we break those down and we spill the contents into the bloodstream? Yeah, it's going to have an effect and we have to be able to manage that appropriately. What happens is, if we're able to lose some of that initial weight and we're actively involved in breaking down those fat cells, the contents of those cells will then be released into the bloodstream. And that can include things like hormones, toxins, and even their own inflammatory mediators. And if we don't have the capacity to be able to process this and clean this up, then there's a high likelihood that it can contribute to a regaining of the weight that we initially lost. This is really hard on a lot of people, and we get stuck in this loop where we're trying to make changes, but every time we do, nothing seems to happen, and so therefore we kind of reserve ourselves to, well, I might as well not exercise, I might as well eat whatever I want because no matter what I do, it doesn't seem to budge the number on the scale. So instead of moving more and eating less, which you guys all know I'm not a huge fan of anyways, what we have to do is refocus and reassess on what the big inflammatory drivers are in our system. Common ones that we often see in practice and are very much tied into the way our thyroid works includes things like gut function, liver and gallbladder pathways, hormonal changes, blood sugar changes either high or low, and also brain health. If we can take a look at those on our labs and also in our examination and assess which ones are working for us and which ones aren't, then we can refocus our efforts to help better support those areas and also manage our inflammation better overall. Additionally, we're going to want to choose a nutritional plan that doesn't focus so much on caloric restriction, but instead focuses on us feeling good. If we can improve our symptoms, then that is a clear indicator that we're managing our inflammation in a much more efficient way. If you need some help determining which dietary approach is best, I've done some videos on that in the past, and I will make sure to link those in the description so you can check those out as well. Lastly, it can be helpful to use some additional supports like anti-inflammatory supplements to help you get over that initial hump. I like to use things like curcumin, glutathione, and vitamin D because they are well tolerated by most people, and they're also very well researched and have been shown to help us to be able to manage these types of conditions. But all in all, if you have thyroid problems and you've been struggling to lose weight, just keep in mind that this is not an effort problem. There's specific adjustments that we have to be able to make for thyroid conditions that will allow us to better manage our inflammation, and therefore that will allow all the efforts that you've been putting into this process to be that much more effective for you. If this information was useful to you today, but you want to work with someone who understands the ins and outs of thyroid and how it relates to our metabolism, send me an email at contact@seattlethyroidhelp.com. That'll also be listed in the description box below, and we can get you all the information you need to be able to set up a free consultation to determine if we are a good fit to work together. Also, make sure to grab my free guide, which is also in the description box below. It's 109 foods to boost your thyroid and improve your energy, and it includes a comprehensive list that I love to use with a lot of my patients on a day-to-day basis. It helps them to start seeing changes in their symptoms and manage that inflammation that we talked so much about in today's video. But that's all I have for you guys today. Thank you so much for hanging out with me. I care about you guys. I hope you're doing well, and if there's anything you need, don't be afraid to reach out. Also, if you liked today's video, don't forget to subscribe to the channel and maybe share it with someone who would find it useful and helpful to them. My name is Dr. Bodle, and I will see all of you next week. Take care, everybody.